From WXOW, this is La Crosse's own News 19 6 p.m. report.
Tonight, a project to better serve the area's uninsured is shifting into high gear. Good evening. Thank you for joining us. I'm Dustin Lukey. A small but significant percent of the area's population remain without health coverage. La Crosse County's 2018 Compass report shows a range of between 5 and 17% uninsured in La Crosse and the surrounding counties. Now, there is currently a free clinic in the city, and tonight we're learning how a collaborative effort will soon fuel a way to bring that clinic closer to all those in need. On the 900 block of Ferry Street sits an unassuming building, opening its doors to provide free health care to between 500 and 600 people each year.
It's a place where Mayo and Gunderson docs, nurses just come together and work really seamlessly.
Executive Director Jason Larson says the St. Clare Health Mission's goal is to offer the same quality health care to the uninsured or underinsured as they would find at any hospital or clinic. But in the tradition of their patron saint, volunteers do so humbly, even those in the highest echelons of leadership.
Last night, Dr. Rathgaber was here to see some GI patients.
And as health care and economic concerns are in focus now more than ever, the mission wants to offer more outreach for its services.
This is the big dream. This is the big goal.
To get that going, a well-known wheel opened a door of opportunity.
And so often we think, well, what if it was me that didn't have insurance? What would I do? We have such a giving community, and I really think Rotary is a large part of that.
Like Rotary Lights or Kids Coulee, something that would, show what happens when the community comes together.
In a show of that continued collaboration, area Rotary clubs partnered up to reach out to a number of agencies to ask,
if you had $200,000 to $300,000 to spend on a project that could really make a difference in people's lives, what would that look like?
For St. Clare Health Mission, the answer is a mobile clinic.
When approached by Rotary, that was the first thing we thought of, is it would be incredible to be able to take St. Clare Health Mission on the road and reach some of these hard-to-reach rural areas.
The vehicle will contain 2 fully functional and confidential exam rooms, as well as diagnostic equipment and pharmaceutical capabilities. That all comes at a cost.
About $240,000.
For a free clinic that saw its operating budget skyrocket this past year from $300,000 to $475,000.
Pharmaceutical costs were about $75,000 to $100,000 more.
Larson says a mobile clinic would have been a dream 2 or 3 years down the road had they relied on the grants and private donations that fund the mission. Rotary's fundraising opportunity makes that math a lot easier.
In Rotary, we often make the joke, 1 + 1 doesn't equal 2, 1 + 1 equals 3.
Here's how. They're working to raise $80,000 through the Rotary Works Foundation. The area clubs are then teaming up to apply for a grant from Rotary International that will triple the total. The catch is, these grants are usually for projects local clubs take to other countries.
In this case, we're actually the host, and we've actually partnered with some clubs from overseas. One of them actually is a German club that our exchange student had come from Germany and stayed with families here in La Crosse.
Perhaps it shouldn't come as a surprise. Communities, both home and abroad, want to rally around this mission. After all, when Larson recently reached out to see about getting a deep freezer for COVID-19 vaccines,
they didn't get a response. They got a medical refrigerator. Right? It just showed up a couple days later.
The open door policy working both ways to move the mission forward. Now, there's no timeline yet for when the actual vehicle will be outfitted and ready to roll. We will keep you posted on that, however. You can learn how to donate to projects like this by finding this story over on our website. And for now, those without insurance can visit the St. Clare Health Mission Tuesday and Thursday evenings from 5 to 7 each week.